Assuming that the fallopian tubes are open, it's really a question of age. Now, IUIs in general are quite successful. And for whatever reason, it's been a major interest of mine for a long time. And one of the reasons is that it's so much less expensive than IVF is. And so many couples are really excellent candidates for IUI. Now, we don't just do IUI alone because it's rarely the right thing to do. Instead, we have the female partner take medications that cause them to release 2 or 3 eggs in the same cycle we're going to do the IUI. So I definitely recommend it for the right women. On the other hand, once a woman reaches the age of 40, pregnancy rates are extremely low with IUIs, and we don't really recommend it there. However, occasionally we'll have a couple that wants to try 2 or 3 cycles, and I think that's absolutely fine as long as they have no other infertility indication that would cause the IUI cycle to not be successful. Now, in some cases, couples choose to do IUIs simply because the female partner does not ovulate. And that's a very effective method for most women that have normal hormone values. So for them, we do up to 6 cycles if everything else is normal. However, for couples that have unexplained fertility, the vast majority of pregnancies happen within 3 to 4 months, and there's really no reason to continue after that. The whole point of all treatment is to find out whether or not that treatment can work, and if it can't work, what needs to be done in order to allow them to become successful. One of the most common questions we get asked is, should I do IUI or should I do IVF? As I mentioned, age is a really important factor, as are hormone values, looking at the AMH level, the FSH and estradiol level, and whether or not there's any underlying cause of infertility is exceedingly important to do. And when you take those things into account, I think it becomes pretty clear for the vast majority of patients, as well as you or a fertility specialist, what the best next step is.